Welcome to my podcast. Today I'm going to talk about another acute situation. So basically, you are like a junior doctor or SHO in an emergency A&E. So basically, they brought you a patient who's unconscious, and they told you, "Hey, doctor, please come and help." And you just try to approach the patient, try to introduce yourself if the patient is responding in any way, try to ask the witness or the person who escorted him just to have background history. However, if you can't get any of that, you have to deal with the unconscious patient immediately. So try to do the A, B, C, D, E in order. It's very essential that to assess that the airway is open and the patient is breathing, because if this one is neglected, you know that the patient will die immediately. And then try to assess the circulation, and then you will do the rest of the things. So basically, you will establish after you check the A, B, C, D, E, and the exposure just to check if there's any fracture or any of that, and assessing that the airway and the breathing is okay, circulation is fine. So, yeah, and if there's any disability as well in the exposure, because it's following order, you will establish if there is any access to the IV, because basically the patient might collapse, check the circulation, as I say, blood pressure, pulse rate, and connect the patient to the cardiac monitor, and of course the oxygen saturation probe. And also send for baseline investigation just to know what's going on. So you basically take for blood sugar, which you will take it from the capillary blood vessel. If it's not possible, you will take it from the cubital or anywhere else. You will send the blood for full blood count as well, your electrolyte, creatinine, calcium, bone profile, toxicology screen. Basically for if there's any suspicion about paracetamol, salicylate, alcohol. LFT, clotting screen, and then you will, as you connect the patient to the monitor, you will check for the ECG and ABG, basically to check about oxygen saturation, and if there is any carbon dioxide, monoxide concentration as well, you will send for it. And you will do the mobile chest X-ray. Maybe the patient has any trauma to the chest as well. And also send for blood sample for culture if there's suspicion of sepsis. And then you will start empirical antibiotic just to cover if there is any infection. Of course, you're not going to mobilize the patient, especially from the cervical area, because there might be a potential injury if this is suspected. And if the patient is not fully aware and you did the Glasgow Coma Scale, if it's 8 or below 8, you have to intubate. And if you can't protect the airway as well, or if there is an effective respiratory drive or poor oxygenation in that condition, you will also intubate. And as I say, the patient blood pressure is low. You will connect for IV fluid resuscitation, preferably with a vasopressor support, and arrange for a critical care to see what's really going on. And of course, after the patient has been stabilized, you need to find out what happened exactly, if there is any witness who witnessed the patient before he collapsed. Ask what happened, where it happened, what exactly happened, if there's any background history. For instance, if the patient is diabetic, did he take any medication? Did he take his breakfast that day? What medication is taken? Or if there is any suicidal note, maybe the patient, he took pills to end his life. And ask if the patient has been well recently, or if he's not feeling himself, or if he had sudden headache all of a sudden, which could point to head injury or bleeding. So all of that you just need to find out in order to assess the patient. And once the patient is stabilized, of course, you'll transfer him to the next care unit you feel it's needed to, and also ask your senior if he did the right thing and if there's nothing is missing, and then you take it from there. I hope by that I just brief you about what measure can be done in acute unconscious patient, because this is one of the stations which happened in lab 2 examination. I remember I had my case and it was AF. Thank you.